people are probably wanting some details on the next steps, because this is really going to be around the baseline survey, because we need to get folks get those completed so that we can begin to get to the next step of how much money people are going to get, all those things that the people who already done the baseline survey waiting to hear about, right? So those, right, Cammy, I see you, right? So yeah, Gabby, I see you guys. So I know that some of you guys are here for that piece, but we won't even be able to get into any of that today, because uh, really the focus is really going to be on the baseline survey as we identify the folks and the participants for the capacity grant. We can then begin to build upon those next steps of the funding allocation and all those better details that you guys are really looking for, right? So this hour is really just for folks who needed any kind of support around the baseline survey. So I only want to open up the floodgates on those next questions, right? Of how much we get in, when y'all gonna send it to us, all those things that people are looking to hear. Really just want to make sure that we give some time for people who need any kind of support on filling out the baseline survey. Okay. Um, and then what we're going to do is we're going to put in the chat. I don't know if Karen's already done it in the chat. We're going to, instead of like opening it where we just have people talking, we'll add the Google Doc inside of the chat, and people can ask questions there. And then Mara's going to read the questions aloud. And if we have an answer, because a lot of answers are still coming from the state, but if we have an answer, then we'll answer openly to you guys around, again, the baseline survey. If we're unable to answer it, then what we will do is take note to any question that we can and get it to DHCS, so we can get an answer. And in there, I think, did we update it? And I'm talking to my team, did we update it to make sure we got their email address? So that way we know to send it to the person who asked that question. Okay, so if you can utilize the form, the Google form, to ask your questions, and then what we'll do is we'll answer from there. And again, if you just got on the call, if you will put your name and your LEA or your school district in there, so we can just capture those folks. See some people from Riverside, so we're happy to have you guys in the room as well. And again, really focusing this hour on the baseline survey completion for the baseline survey, folks who need some support. Okay. So, Manuel, you want to start if we have any questions at this point?
Yeah, we have one question from Rialto Unified School District. It's just wanted clarification in regards to the multi-payer fee schedule. If a student has an IEP and received behavioral health services not included in their IEP, are these eligible for CYBHI claims? And are there any new updates in the PPA and DUA agreements?
Okay. So again, this ain't this, I did get this one early. So Cecilia, thank you for the question. Not a baseline question, but some folks might want to hear it. But so the answer I got back was, if a student is receiving behavioral health services and it's not in their IEP, then that student, then the billing would go to the CYBHI side of the work, right? So you would be billing CYBHI if it's not in the IEP of the student. Okay, if the services are not already billed. If the services, of course, if they are in the IEP, then you would utilize LEA BOP to do it, right? So and then the agreements for the DUA and the PPA, the data use agreement is DUA for folks who I want to do acronyms for, right? So the data use agreement and the what was the PPA? The
Provider participant agreement.
Yes, agreement. Those are being reviewed by a I don't want to call it a panel, but a group of people who are coordinators who are looking at it to make sure it's right. So they're going to kind of get feedback from the this group, and then they're going to give it out to the cohort one folks to get one last feedback from them, and then they're going to be finalized. So it's really still a draft at this point, Cecilia. Okay. Yes. So any y'all got no questions?
No, we have actually
Oh,
a
okay.
couple.
Okay.
So,
Okay.
so from Granite Mountain Charter School, the question is, we are not qualified under Medi-Cal. Is it required to be pre-qualified in order to be eligible for the grant?
No. So to participate in the capacity grant, you do not have to be Medi-Cal enrolled. If you are going to be in the cohort, right now DHCS is saying yes, but that might change later in the later cohorts. But to participate in the capacity grant, you do not have to already be Medi-Cal enrolled. It is an opportunity to actually, you can utilize the funds in the capacity grant to even do that. So it's not to participate in capacity grant. Capacity grant is just at some point you're saying, I am going to utilize the fee schedule at some point. They haven't said that you got to do it in 2 years, 3 years, but you just plan at some point utilizing the fee schedule is your only requirement to participate in the capacity grant, and then of course completing the baseline survey. Okay.
We have another question as well from
Okay.
Ukaipa Joint Unified School District. So the question is, I'm still uncertain of what we can request money specifically for. Can it be for more staffing? What else can we use it for? I'm partially unsure of what to ask for, as I'm not sure of how the CYBHI will function. Will it continue through SpedCare or a brand new process? I'm going to copy and paste that in the chat just in case I said it too fast.
Okay. No, so really you're looking at what are the things that the allocation could be spent upon. So they're looking at 4 categories in the capacity grant, and they're looking at Medi-Cal enrollment, and that's like the district or the LEA being enrolled, right? And in there you could fund people, you could fund people to do that. You can fund even the enrollment process of it. Service delivery, which is going to be in the hiring or the contracting of service providers. In that service delivery, it's also money can be spent on spacing. So again, the service delivery is really going to be built around the service delivery and the access to those services. So if Lauren, you guys have therapists, but you don't have private spaces, the money could be used to create private spacing, right? Then the other 2 are data collection and documentation. So in those, funds can be utilized to purchase an EHR system, right? To contract with third-party administrator vendors like Practical or Paradigm, those kind of deal, right? So you can use the money to do that as well. And then also in the documentation, a documentation system, you can utilize the money for that as well. So what we'll do, and I know we have it in the live binder. We'll share the live binder's already been shared, but we'll keep you guys bring that in the chat, because in the live binder, the funding, there's some funding information in the live binder that you can kind of see what I can spend the funds on. Okay. So you look in there, in some of the guidance, there's some guidance around how the monies can be spent. Really utilizing your baseline survey, and then your implementation plan should be informing those things, right? So as you're seeing where your gaps are in your baseline survey. So as we're here for the baseline survey is really just an opportunity for you to assess where you are at this point, right? And then see, it's no test or saying, oh, you don't have enough, or it's not that kind of survey. It's actually just a self-assessment of your systems. So then from there, your implementation plan will really help support filling in some of those gaps that you've identified in your baseline survey, right? Okay, so Lauren, does that help?
It does, James. Thank you. I think the question is can we use the money to continue things? So for example, we were talking about practical consultants. They
Hmm.
have a fee. Can we use the money to supplement and continue to
Yes.
pay for some, and our EHR that we just got one?
Yeah.
That's expensive, you know, like, oh, we just got one.
Yeah.
Can we use that to continue that funding as
Yes.
well?
Yes.
Okay.
Yes.
To
And
what
then,
we
like I
already
said,
have.
yeah, and then in your implementation plan, you're really looking at how will you build the sustainable systems to keep it going, right? So as you're doing, you have those things in place, uh, getting prepared to begin to utilize the fee schedule you might be on the faster track to utilize the fee schedule to help uh, sustain some of that, right? So you might want to jump in the later cohorts to support with, because again, this is seed money, right? So this is going to be the seed money to really build your system, to help bolster your system, and then really on the back end of it is really the sustainability mechanism on the back end of it. All right. Okay. Thank you, Laura.
So we have another question from Bear Valley Unified School District.
Okay.
It is my understanding that we don't need to be signed up for a cohort in order to apply for the capacity grant funds. In that case, what are the grant funds intended to be used for?
So yeah, you don't have to be in a cohort to receive the capacity grant money. What the capacity grant money is really to build your readiness to develop countywide operational readiness for the fee schedule. So the state has provided this money to each of the 58 counties to build their capacity to one day utilize the fee schedule throughout the county. So these funds are really utilized to bolster San Bernardino County, or we got some Riverside folk, Riverside County, in developing like this youth network of behavioral health services across the counties, right? So we have these schools and these, or some of our partners, our community-based partners who can provide services to our students. And one of the mechanisms to bill or to receive funds for those services would be the fee schedule. And so they've invested this money in each of the counties to build the system, the countywide system on in utilizing the fee schedule. So you don't have to be a part of the cohort. All you got to be looking to one day utilize the fee schedule at some point. So yes, Bear Valley, you don't have to be in a cohort to receive the funds.
All right, we have another question from
Okay.
Morongo Unified School District. When do we find out if we will receive the capacity grant? And is there a list of how the funding can be utilized? So in like an allowable cost sheet.
Mm-hmm. So for the latter question, in the live binder, you can look at some of the guidance around the funding, how funds can be used. Now I lost what the first part of the question was, Maura.
No worries. When do we find out that we received the capacity grant?
So anyone who completes the baseline survey is going to be a part of the capacity grant. So and they call it a grant, but it's not like a grant where we do like an RFP or things like that. It's for every district and LEA in the county to participate. They just have to do the baseline survey. You have to do the baseline survey to participate. When we know, this is why we have to identify who's actually going to participate in our county, and at least just in San Bernardino County, y'all. Who's going to participate in San Bernardino County portion of the capacity grant, because then that's going to inform our next steps of the funding allocation as well, right? So as we are in the process of building our allocation, because it comes from the county office, the allocation formula comes from us, but how the money is going to be dispersed and how much folks are going to get is going to depend on the number of participants in the county.
So you kind of touched a little bit about this, but this is Morongo Unified is asking how much money will we receive for the capacity grant? Is this a multi-year funding? And what is the funding accountability?
So it is multi-year. It's 2 years. So really, the state this was actually supposed to be happening a year and a half ago. State is behind, just as our cohort one should have been billing early on, right? So the state is really flying. What they say, flying and playing as they are fixing the plane as they're flying it, right? So it's 2 years, so the money is going to last till 2026. I believe the monies have to be encumbered by October of 26, and I'll get make sure, I know y'all writing that down. I'm gonna make sure I'm right on that. But right, I see you, Cammy. But so it is multi-year funding. Uh, Again, how we know how much folks will get is going to be really based on the number of participants in our county. It was another part to that question, Madara.
What is the funding accountability?
So in what the state is asking is that each of the participating districts would be completing a progress report. Progress reports are going to be due July of 25, or January of 25, July of 25, and then July of 26. Right, and that's going to be kind of a status report, right? So it should be really based on your implementation plan. Where your implementation plan is would be, you will be progressing on how you're working towards that implementation plan. So again, January 25, July of 25, and then July of 26 are the dates that they have right now. Those are the latest dates that we have for the progress reports. And so that's really going to be where the accountability is going to be.
Okay, so we have a question from New View Union.
Okay.
Which electronic health records are ready to process CYBHI? In my survey, I did not see anything about choosing whether I wanted to join a COE cohort or be independent, but I have heard that it is a determining factor on the survey. Can you please clarify?
So say that again.
Yeah, I'll put it in the chat too. So which electronic health records are ready to process CYBHI? And in the survey, I did not see anything about choosing whether I wanted to join a COE cohort or be independent, but I have heard that it is a determining factor on the survey. Can you please clarify?
Okay, so the EHRs, those are still, I don't really have answers for that piece because that is still kind of being built with cohort one. So the state is utilizing a third-party administrator by the name of Caroline to who's going to be doing all of the billing, who's going to be the billing between the state, or the communication between the state and the LEA. So Caroline has not, the system isn't built yet. That's why cohort one isn't billing yet, right? So there's a lot of technicality that I don't have answers to. So I can't answer that piece. As far as the second part of it is choosing whether you want to join a COE cohort or to be independent. So for our county, we're not demanding or expecting that people are going to utilize some kind of consortium unless this is the way that they identify that they want to do it. So for instance, if San Bernardino and Redlands wanted to buy a EHR and they wanted to utilize their individual funds to do that, they want to bring it together, we would just be the office to pay for it on their behalf. But if New View is going to participate, the allocation would be their independent allocation. That's the way our county is doing it, right? So counties are doing it different ways. Our county is doing it that you would have your independent money.
Okay, we have a question from Cami. Will we be getting more information on creating the implementation plan? Is that after the baseline survey and the operational readiness, or should we be doing that now?
So no, what I would recommend, and we met as a team earlier today, is once we identify our participants. So once the state says, okay, it's closed. This is this is who put in for the baseline survey. Then we, from the county office, would then we would have a meeting with those participants to begin to do our plan as a county. Like those would be the county, San Bernardino County folks plan. Like you would be a part of the collaborative plan, right? So there would be some guidance from us as far as like our allocation formula, which we would then vet alongside with you all. We would, we want to make it for our county, we want to be very collaborative in the way that we go about it. So we would get guidance from the state that says, all right, we're ready to move to the next part. And then we would hold a call like this and have a little town hall meeting to talk about next steps. Okay, so no, Cami, we certainly gonna be updating you guys. So I wouldn't do anything with the implementation plan. We've been working on our implementation plan because the county has to submit theirs first, and county submits theirs, then it's gonna be due 60 days after the time that we submit it. But again, those are all gonna be very well communicated with the participants. So we're trying to make sure to not mix the actual participant part of the project with the kind of general part of it, right? So that we're very involved with the people who are participating. Because if you're not necessarily involved in it, we don't want you calling shots on it. You guys know what I mean, right? Oh, you should be spending money like this, but we're not going to participate. Like that ain't fair for the people who are participating. So we want to really engage the technicalities, the details with the folks who are going to be fully participating in it. Hope that helps. Okay.
Okay, we have another question from Bear Valley Unified School District. The question is, what staff positions are other districts using to provide services? Our school counselors and psychologists do not have the capacity to provide additional services on top of LEA BOP and their normal day-to-day tasks. Is there another opportunity for grant funds if we pass up this opportunity?
As of right now, there are not anything that we are aware of as far as other opportunities at this point. We don't know anything. What one of the and maybe some of the other folks can kind of talk. If you have some other people who are providing services, we can certainly collaborate on that. Some partners. So even as we're building this system countywide, one of the things that the state is going to be looking at is not looking at, but it's going to be allowed where if a district or LEA doesn't have the capacity to have their own therapists or things like that, that you can have an affiliated partner who is a community-based organization who can bill on your behalf, right? So one of the major pieces of this is of this capacity grant and just the countywide, and our vision for it is really that we build this strong collaboration and collective impact in the work that we're doing. So we have districts who don't have the capacity to hire their own therapists, right? So now we need to be engaging with partners, community-based partners who can provide those services or can be a support so those kids can still access services. And then they can be those community-based organizations can be on your kind of provider list, right? Because it's kind of like becoming a network. They would be on your network list and they would be able to bill on your behalf, right? So that would be one of the ways to do that. I don't know if there's other people on the call who can kind of speak to other ways or other ideas that could speak to that.
James, I had a thought. So I was just explaining it to our staff. So I'm a therapist with our school district, and your counselors and therapists, if you're not one yourself, might just be less familiar. So you might see a student because they have a need, but they are Medi-Cal. So that's when we were billing LEA BOP. But now if we saw that student and they were non-Medi-Cal, so they were Anthem Blue Cross, we can now bill for them. And so it's not, in my mind, necessarily adding more therapists, which it sounds like is a different option. You're just being able to bill for students you weren't able to before through only Medi-Cal. So now they might already be, those school counselors might be seeing students and they were only able to bill for about 50% of them, and now they can bill for the majority of them through this. So is that correct?
Oh, absolutely. Absolutely. Yes. So yeah, if you are able, you have the capacity to take on more students, then you could utilize, you could see those general students who are receiving, who you've been centrally funding some of the servicing for, who aren't in IEP, who aren't managed care plan, folks who aren't in LEA, but who aren't in any of those programs. This would allow you to begin to bill for some of those folks who are Kaiser, and Kaiser is going to be Kaiser is a managed care plan now in California, but Blue Anthem and Blue Cross and those kind of different insurers, you would be able to bill those. The whole point of the capacity grant is to build the infrastructure in your district or your LEA to be able to do that at some point, right? And there's going to be certain, and that through the process you're going to find out, and that's part of the baseline survey. Through that process, you're going to find out what are those things I have to have in place in order to do that. So as OMSD is on the call, OMSD is in cohort 2. There are certain things as the applicant for cohort 2 that they had to have in place to be ready, to be deemed operational ready to utilize the fee schedule. The capacity grant is an opportunity for our LEAs, our districts, to begin to build the muscles to become operational ready. So where the managed care plans and the commercial insurers are going to say, yes, we will give you back the money because you are you have the systems and programs in place to actually be identified as a network, as a provider, right? And so through this process, part of the technical assistance that we would be, as we get guidance from the state, we then will be providing that kind of guidance to our capacity grant participants through our county, and then also utilizing what's happening in our county to actually to inform and develop some best practices throughout the county, right? So you're utilizing the participants to really help us create that a toolkit that can be utilized as the county implementation, right? So it's really going to be us really identifying those best practices for operational readiness through this money. Thank you for that, Lauren. Anybody else want to speak to that, or just other ways? And in the live binder, there are the scope of services, and those is kind of a draft still, but the scope of services are in there. The practitioners or the people who are allowed to provide those services. So when we're thinking about our school counselors, I was a school counselor before I became an administrator, and there was many things that we did that were not billable, right? That some of those things are going to be able to be billed through this system now. And so, and it's not just the commercial insurers. Managed care plans are a part of that as well. So managed care plan will also, so if we see some students who are Medi-Cal students, and it's not because of an IEP, I can still charge the managed care plan for the services. I can build a managed care plan too. So it's not just those commercial insurers. This is going to be all payer. And that's really what it's called, the all payer fee schedule, right? All payers can be billed for the services. So we do some tier 1 things. We could some screening, right? That's on the scope of services. Some screenings that we might do. We can bill for those screenings to whoever the students are. So big part of the readiness is going to be, what are the systems we put in place to even get our students? I know we do it in the beginning of the school year to get the insurance and all that kind of stuff, but it's going to be very intentional. We got to be very intentional about getting that. And so I think it's really going to start with us messaging information out to our families, right? The importance of them actually filling out those emergency cards. I know we don't do emergency cards anymore. I know they do it online now, but the emergency information and that insurance information, because it will help with the sustainability of many of our programming. Muddle, any other questions?
Yeah, so we have another question from Ukaipa. Is it the LEA that applies, completes the baseline survey or specific sites? We have one school that completed it not knowing.
Yeah, no, it would be the district. It would be your district. Yeah, and then then what'll happen, so like for the cohorts one and twos, they've identified LEAs in their application of like, oh, you know, Ukaiba High School is going to be a site, right? Or going to be one of the providers. So it's going to be your district, but then you might have different um, sites that where the services are provided. So again, when the information is sent to the TPA, those provider, it's like a provider list. So these are the places and these are the people who can do it. So those is going to be that level of detail in again, we dealing with commercial, we dealing with insurance, right? They're going to want to know, they're going to want your T's crossed and I's dotted, or however you say it, right, in order to pay. So you're going to have to identify where services are being provided, who's providing them, and all those things are going to have to be on the list to actually be to bill for them, right? So it would be your district, and then your district would then have different providing sites per se. Okay.
So we have another question from PAL Charter Academy. Do you need to have any prerequisites, resource, staff, etc., in place to participate?
For the capacity grant, no, Mr. Muhammad, no. This is actually an opportunity to build those things, right? Depending on how much money you get, prioritizing, and again, that's where your baseline survey, seeing where your highest needs are, prioritizing it, and then utilizing those priorities to really inform your implementation plan would be a great way to approach it, right? Really seeing what are those maybe the low hanging fruit that we can get done right now that can maybe help build some sustainability mechanisms in our systems. So again, but again, as I was saying earlier, like the best practices, this is all new. This is gonna just 10 years from now, this is gonna be the way of working, right? But we're at the beginning of it. For San Bernardino County, and we get the telling my team, we get the privilege of getting to lead this. We get to say how it's gonna go. Like it's really this group, the people who are gonna participate are really the early adopters, the champions. We're going to say how this is going to look for the next couple of years. So we have to build those best practices and what are going to be those priorities, right? Pal said this was, but it didn't go as well. Maybe this was the best way. So we're going to be learning as we're going. And that's what we really want to develop, this kind of collaborative conversation, this energy for our county to really start identifying what are going to be those best ways to approach it. So even if the capacity grant is over or some more money does come, we can help folks who start after us to say, hey, this is the way you want to go, right? We want to really provide some guidance and help folks not step in some of the landmines that we probably will have to step into to get it going. So, yeah. So just identify through your baseline survey of those priorities that are gonna make it best for a PAL, Mr. Muhammad. Gonna be the best way I would encourage.
We have another question from Inland Empire Springs Charter School. For charter school organizations that have charters in more than one county, do we need to submit a survey for each county? Empire Springs and Inland Empire Springs are charters located in San Bernardino County, but they have an overarching central office that supports them in Temecula.
Yes. So one of the things we did hear from the state is that you can apply for the grant in each of the counties that you serve. Okay, so that was new information for us. Thinking, oh, you have to be in time, you got to be in one. No, they said wherever you are, you can apply in each of the counties, but you would do it in that baseline survey for each of those counties. Okay.
Okay, we have another question from Morongo Unified School District. Is there a recommendation for an electronic health record system program?
No, not yet. We are trying to do our due diligence of vetting, because right now with the money, many of the vendors are uh, uh, they lurking. They out there, man. They out there. They're what we gave what we gave guidance to, provide guidance through our superintendent the um, to our county superintendents, the superintendents in our county, was to really hold off on signing any kind of contracts till we get more guidance from the state. And I say that because, and I'm not talking as far as like, if you did your EHRs and all that, but I'm talking there's some people who are coming around who are saying that they already have the solution for this fee schedule, right? But Caroline, who again is the third party administrator that everyone's going to have to go through, hasn't provided the guidance that said this is what the solution is. So anyone who says they have a solution is not, I don't want to say they lying, but they're not all the way informed yet because the state hasn't informed us on what that looks like yet. And so one of the things that could come out of the work that we're doing is us identifying a countywide solution that the county could, if we the participants identify, say this is something that we want to spend the funds on, that we want to have a countywide solution, and we want to use some of our funds to make that happen as a county, right? And it could speak to our different districts, to their third party administrators. So they're using Practical, but they're going to utilize this one system. It's our vision that we would love to have one county, one EHR, right? Right. That's the vision. And so, but we got to find the right solution that can do that for us. So we are looking at from the county office as considering the spending some of the funds, some of our funds to do some collective impact around the EHR that we can all use, the participants can all use, and not like again, not an EHR, but it's really it's not an EHR because EHR would be built inside of it. It's another term for it. It's like a management system, though, but your EHRs would work in it. Practical would speak to it, or Paradigm, whatever thing, but it would be something that we would all be able to utilize, and it helps with speaking to some of your community-based organizations. They can be involved in it, as well as district to district. So if we have Rialto and Fontana are in the system, and the student leaves from Rialto to Fontana, the system still has that. So it's something that we want to, as a county, we're really looking to see how do we have some continuity in care, right? Continuity of care. Some of the things that we're missing, where we're getting kids and we're starting over services because we don't have the documentation, right? Which makes it very difficult, and families lose trust in us because we take them through the system again or take them through that process. So that is a consideration of finding some of the solutions, because again, they're out there right now. They know about this. They must know about this money before we did, because they already got things in place to come to make something happen. So, but we are recommending, if people are coming to you guys, hold off on it, or let us know, because we can vet it with the state and see if this is a vendor who the state is identified or seen as promising. So hope that helps.
All right, we have another question from Empire Springs Charter School. You may have already answered. I joined late.
Okay.
Is there an estimate of when the funding would actually get to the LEAs? I know the county has to submit their plan first.
Yeah. So actually, we don't have a date on it. We are actually in the process of invoicing the state for 50%. So when we did already sign the MOU, and I say we being the county office of education, San Bernardino County Office, or San Bernardino County Superintendent of Schools, has signed the MOU with Santa Clara, and Sacramento. What that does is it gives us 50% of the money, right? So it releases 50% of the total money. So we are in the process of invoicing the state for that 50%. So, but what we're looking at from our end is really just the guidance on the state telling us, okay, the baseline survey has happened. This is where we expect you guys to go next, right? So we haven't had that kind of guidance. So I don't have a date or a timeline on it. I'm hoping that after the first and we identify the participants, that it goes a lot faster than it has been going. That is our hope. Was there another part to that, Marwa?
No.
Okay.
That was it. But we do have a question in the chat from Nora. Is the capacity grant the same as CYBHI?
Yeah, so the capacity grant is one of the it's from one of the work streams of CYBHI. So CYBHI has over 20 something work streams. So in the CYBHI initiative, right, the almost the $5 billion, this is part of that $5 billion initiative that the governor has put for around behavioral mental health of young people, right, 0 to 25. And so this is under the umbrella of CYBHI. So it's, people are going to say, oh yeah, you get that CYBHI money. There's many different CYBHI monies, right? So this is the capacity grant is under the umbrella of CYBHI. It's part of the initiative. Is that what you heard, Nora? Is that sound right? Or you heard two different things? Okay.
We don't have any more questions in the form. So
okay. So we got about 17 more minutes of this of time, but I want to again, just if people are still haven't done the baseline survey, still kind of in limbo of thinking, consideration, like if I want to do it, we would really suggest participating. Again, it's an opportunity to build the systems and to provide services for students as we are losing much of those ESSER funds and all the things that we've used to support students at this point are beginning to sunset. This is going to be the new wave of us sustaining some of our systems, especially as we move towards leaner times in education, right? And so I think the state is already seeing that it's going to be important for us to become savvy at the sustainability mechanisms. So really working, and one of the things I want to really speak to is this work has to really live at the district level, right? Many times we have put it with a certain person, we put it in the behavioral health team or something like that, but this has to work in collaboration with our ESMA, our LEA BOP, all of those Medi-Cal systems. So if you're a Medi-Cal person who probably lives in special ed, the coordinator probably lives in special ed, and not the administrative coordinator, but the coordinator who does all your billing and all that stuff might live in special ed, and then this work is going to live on the behavioral health side. And many of those people are not talking, don't even know that these two programs are existing. But it's going to be very imperative that we begin to work together because a lot of the information that is coming from the state, much of the guidance is actually coming to that special ed LEA BOP person. Like they have a lot of the information. They don't have a lot of the CYBHI information, but they have a lot of the guidance on the Medi-Cal stuff, the LEA BOP, the ESMA, making sure we have the right people in those pools that are going to give us a certain amount of money, but making sure we have the pools and the people in the pool that can continue to give us the right money. So that's going to be part of the technical assistance and work from our office to really support our LEAs in really learning to utilize those the SMA funds and the LEA BOP in the way that can be most efficient alongside with the CYBHI fee schedule, right? So really making sure we're doing that. That's going to be huge because that's what when we've been meeting with districts, those folks who are doing the LEA BOP and SMANA have no idea around CY, have no idea around the fee schedule, which is going to be a major barrier to the sustainability, y'all. So really making sure that we inform and we keep them in the know, the behavioral health side with the know of that. Usually that lives in special ed, that piece that lives in special ed. Okay. You have another question? Oh, if you have another question.
Yeah, we have another question in the form from Powell Charter Academy. What role will SBCSS play in working with schools and districts?
Yeah, so our role is really going to be to provide kind of this universal tier one kind of support, right? Where we get guidance from the state, and we make sure to interpret it and give it to you guys in a way that's palatable and easy for you guys to move to the next, part of the process. So really get guidance from the state and then provide that for you guys to continue to do the work that you guys are doing. So we want to just make sure we filter all the things that you don't need, give you what you need, so you guys continue to provide the services for the kids. So to be through these community practices, through different office hours. So one of the things that we are going to be doing is making sure to have frequent office hours around the fee schedule. It could be us utilizing, highlighting a district who's doing something. It's really like a learning community that we want to kind of develop. Really utilize the input of the participants to say, hey, let's have some conversation around this. If it's some state people that we want to bring in, it'll be our the county office really wants to just create that learning space and that capacity building. Like that's really what we want to do, and we want to do it in a way that makes it easy for you guys to keep doing the work. Like it isn't like extra. It's like, oh my gosh, I don't want to do this, right? We really want to create it from a school perspective of like, this is what they need. Let's make it easy for them. Let's get them what they need, and let's keep it going. And then if we have, of course, we would always be there to support any of our LEAs in individual support as well. And it's not a lot of us, but again, we would do our best to support the individually too. But really developing that collaborative learning environment for this work, really change how our county does this is really what we want. Like we want to build our county system like as our districts do it, but we really have like a county, like, man, San Bernardino County really has a network that is a machine. So we want to develop that kind of level machine in our county. So we just want to lead it, facilitate it, but really learn from the practitioner in the field. So really let the field lead it as we just create the space for the field to grow. Is really our hopes and our goal. Get out the way and let y'all do what y'all need to do.
Don't have any more questions in the
No
form.
more questions?
Yeah, or in
Okay.
the chat.
Okay. So as I said, we're going to, after the first, we are going to be reaching out to you all who are participating for next steps, really beginning to develop our plan, allow you guys to have feedback, provide feedback, and even in our own implementation plan before we send it off. And then that way, when we send it off, you guys are already aware, like, okay, we got 60 days from there to do our plan, right? And so, again, we're kind of learning as we go. I'm hoping that I was able to answer questions and you guys feel okay to at least complete the survey. Again, like I said, complete the survey and after we complete the survey, we can learn the next steps, y'all. But get the survey done so that way you have the opportunity to receive some funds to help support in your building of your system. I know for the Riverside side, I believe the contact is Kathy King for Riverside districts from COE. So Kathy King is the one I see on the calls from Riverside. So if there are questions pertaining or specific to your county, that's the name of the person I've seen from Riverside County. And then if you guys have specific questions for our team, we'll put the we have the SLP capacity grant email that we're always checking. And also, if you come up with a question, we'll be checking this too for the next couple of days as well, just in case things come up. Okay, so Karen, thank you for putting Kathy's email in there. And then like I said, put the SLP, you guys save that. A lot of the communication around the capacity grant will be coming from there. And then if you guys have capacity grant questions, then you can send them directly there as well. That's okay. And then of course, in the live binder, lastly, a lot of the information is in there. As we get more guidance and more information and documents, we update the live binder. So you guys have that as well, right? So we'll keep you guys abreast on that. And then never hesitate to reach out directly to us as well either. So however we can support that, that's what we want to make sure we're doing. Okay. Any last questions, comments, concerns before we close it out? No. Well, thank you guys. You guys have been a great audience. Now, thank you guys for your time and really looking forward to the next steps. Okay. Thank you all. We'll stay on just in case people were nervous to say something out loud.
Yeah, thank you. Thank you very much.
Yeah, thank you all. Thank
Yes.
you all.